Bismillahirrahmanirrahim. Welcome guys with another video, and today in this video we will be talking about how to analyze and how to find the important findings of OPG radiograph and how to look on OPG radiograph. So without wasting any more time, let's move on to the video. So what do you think, what is an OPG radiograph and how it looks like and why we need an OPG radiograph? The answer is an OPG radiograph is a type of panoramic dental X-ray that provides a comprehensive view of the upper and lower jaw bones, teeth and surrounding soft tissues. Moreover, it's a two-dimensional image that provides a panoramic view of the entire dental arch, just like the arch of the stone mile. The image can show not only the teeth and the jaw bones but also other important structures of the oral cavity such as sinuses and temporomandibular joint and other hard and soft tissues. Basically, the OPG radiograph is commonly used to assess the dental health and the dental arch to detect any abnormalities and the treatment planning. Now the question raises, why is this OPG radiograph is so much important and why we need it? Well, this question has multiple answers. Well, firstly, it allows the dentist to assess the health of the entire dental arch, to detect any abnormalities and obviously the treatment planning. Well, in this radiograph you can clearly see multiple radio opacities. The radio opacities are those parts and those portions of on the radiograph which are lighter in shade, and there are multiple radiolucencies as well. Well, you can clearly see radiolucencies are a darkish part of the radiograph. In addition, it is very important to assess the radiograph in different branches of dentistry. For example, if I talk about surgery, the surgeon has so much importance to look the BDRs and dental impactions of the wisdom tooth and the periapical pathologies like cysts of the jaws and cervical areas, obviously. But if I talk about, let's say, periodontology, a periodontologist will focus on more focus on the bone loss and vertical bone loss and the horizontal bone loss and obviously the lamina dura and the perial fibers as well. Like I have already discussed, OPG radiograph can show the presence of impacted teeth, jaw tumors, cysts and other growths like granuloma, and can also be used to monitor the progress of orthodontic treatment as well. In addition, while analyzing an OPG radiograph, there are several key things to look for. For example, if I talk about an OPG radiograph, a dentist should know where is temporomandibular joint, where is glenoid fossa, where is condyle and coronoid process, and where is inferior alveolar canal through which inferior alveolar nerve passes, and how much the sinus boundary limits, and how much the teeth are present in the oral cavity, either it is deciduous or permanent, and either is there any missing tooth available. An orthodontist will always look for teeth positioning and the malalignment of the teeth and the mixed dentition as well, while an endodontist will always look for pulpal pathologies and periapical pathologies, and if there is any radiolucency in the crown, coronal portion and the root portion, or if there is any radiopacity, root canal treatment as well. And obviously, while observing an OPG, a dentist should know the missing or extra teeth in the oral cavity, and while observing a mixed dentition, he should know what is the exact time of the deciduous teeth to shed off and what will be the time of permanent dentition to erupt. We can clearly look onto the sinus infections and pathologies if patient can present with sinusitis or the symptoms and signs of the sinus problems. After all, we can easily look for any signs of temporomandibular joint TMJ problems such as displaced disc through an OPG radiograph, as this is one of the most important and most common joint pain in the worldwide after headache and backache. And after all observing this radiograph, what to expect for? Obviously, what are the problem list of the patient and what are the solutions of this patient? After full OPG radiograph analysis and observation, your dentist will be able to provide you with a comprehensive assessment of your dental health and treatment. And here we reach the most important part for the medical students, that how to present an OPG to the teachers in an OSCE station or in an exam or Viva. So first of all, try to present it. This is a radiographic presentation. First of all, you have to say this is a radiographic presentation bracket orthopantomogram, or you can write OPG in your Viva or mark sheets. Then start with the simpler things. You can identify the difference between hard and soft tissues. Obviously in radiograph you can't soft tissues can't be visible, but you can identify hard tissues. You can start with 4 quadrants, divide the OPG in 4 quadrants, upper 2 and lower 2, and then comes on to the number of teeth, how many teeth are present in the oral cavity. On a radiograph you can clearly see a number of missing teeth, you can get the rough idea of the age of the patient. Then comes on to the landmarks. Different landmarks we have already discussed. Any periapical pathologies which can be clearly seen radiolucency, and any restoration which can be clearly seen as radio opacities or lighter in shade. And obviously with all these findings you have to present the bone loss, either it is vertical bone loss or horizontal bone loss, as in this radiograph we can easily identify in both the wisdom teeth which are mesially angulated 4-8 and 3-8, there are proximal or vertical bone loss mesial to the 4-8 and 3-8.